So, good afternoon, everyone. My name is Annabelle Lorenzo. I'm the sales manager for DYN'R US Inc. And today we have Dr. Markus Dahlke from CURAVID, Radiation Therapy and Radiology. We are going to talk about patient safety and workflow management. Markus is going to give us his feedback today. He's the managing director and head of medical physics in a center in Germany. So, Markus, the floor is yours. Have a good presentation, and then we will answer every question at the end.
Yes, thank you, Annabelle, for your invitation to this webinar. I'm proud to be here and that I can share my experience with the complete car plan system. Yeah, as you told, I'm Markus Dahlke from CURAVID. At the beginning, I want to tell you something about our practice, who we are and where we are. So we are a private practice for radiology and radiotherapy located in the northern of Germany. Here you can see it. We are located above Hamburg and then up to the Baltic Sea. We are founded in 1962, so we have over 60 years experience in radiology, and in the year 1978, the first radiotherapy with cobalt 60 treatment machines was implemented. So we have several years of experience in the field of radiology and radiotherapy. We are working on 3 locations for radiotherapy. One is located in the middle of our catchment area, and 2 locations in Lubeck. One is attached to a hospital and one is in a medical center. And we have 1 location for radiology where we will do mostly the imaging for our oncology patients. Our catchment area is with a size of over 2,300 square kilometer, relative big, and we have a population of over 500,000 inhabitants we will treat. And together in all our sites, we will treat 3,500 patients per year in the radiotherapy. And nowadays we have 80 employees who will be there for every patient. Okay, how we are equipped. So our radiotherapy department is equipped with TrueBeam and Halcyon linear accelerators. On each of our sites, we have 1 accelerator, and we will have a low-dose brachytherapy at a separate hospital. We will use IGRT technique and SGRT techniques for every patient, for every fraction, and we will also do gating retrospective and prospective for dedicated patient cohort. Our radiology is equipped with a CT, MRI, normal X-ray examination, mammography, and sonography. But as I told before, we will mostly use it for our oncology patients, which we will treat afterwards. Okay, now let us start with patient safety and workflow management, and why is this important and useful for a clinic. Okay, we will start with the patient safety, and why is safety for patients important? It's possible that you can get from time to time patient mix-ups. Depends on different reasons. So the patients with identical names can be at the same time at the hospital, or you also can have patients who don't want to wait. So for our clinic, we had a patient, I will call him Mr. X, and Mr. X was waiting for 10 minutes, and colleagues are calling Mr. Y to come to the dressing room. Mr. X stands up and goes to the dressing room and wants to be treated, and the staff ask who he is, and he said, "Oh, I'm Mr. X." And then they mentioned that's the wrong patient, and as they asked why he is coming, he told us, "Okay, I don't want to wait any longer." And so to avoid something like this, a patient safety system is really helpful and really necessary. And also for elderly patients or patients who are confused, it's really good. Patients who are not knowing their real name or who can't answer on questions, a system which can avoid errors is really helpful. If you have a patient safety system, the RTTs can concentrate on the core task and are more relieved, so they can spend more time to talking to the patients for normal for some personal things, and they don't have to ask so many questions. A technical solution can reduce errors rapidly and also lead to a better feeling for the patient. So we ask our patients how they feel with the system, and as we started with such a system, we ask patients to knowing the system, the manual system and an automatical system, and they are telling us they are feeling better because they are an active part of the treatment. If they can come to the treatment room and they have to verify, then it's a really good feeling that they can do something for their therapy. And even for Germany, some authorities want to make a technical solution mandatory for the radiotherapy. Okay, how we did it in the past or how it's done in general. You can do a manual comparison between an open treatment at the treatment machine and the actual patient who is coming to the treatment room. You can ask for a date of birth. You can have a look at the photograph, and you can ask the patient for the name. And to make this a little bit easier, we built an identification system on our own in the past with a check-in card. On the card, there was a picture and the name and a barcode. And this card, or the scanner, was connected to the treatment software, and only with this card verification, the treatment could start. But what are the problems? So if you will use a manual method, not a automatic method, it takes much time. You have to ask, you have to look, and if you have RTTs who are not every day at this treatment machine and they don't know the patient, they don't know how they look or how they are, who they are, then it can lead to errors. And every manual method can lead to errors and takes more time. Um, I will come back to our barcode card. So we also had a problem with this card, even if it was an I will call it automatical method. We got hygienic problems as the Corona pandemic started or coming up. We have seen the patients who are putting the barcode card in the mouth for get disinfection fluid on their hands and disinfect the hands. Then they put the card back from the mouth and gave it to the RTT. So this is something we don't want to have and we don't want to see. So these cards are really, really bad. What means hygienic? You can mix cards. So if you will, if there's some cards falling on the bottom and you even have no photo or you will not look at the photo, you can mix it up. The patient can forget the cards or they can lose cards. A workflow leads to less stress and more well-being for the patients and also for the staff. And every step in the workflow where patient and staff interaction is necessary can lead to errors. If you have to ask a patient for a name, then the patient can say a wrong name, or if you will ask for a birth date and if it's right and we have an weird patient, the patient will say every time yes, 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 even if it's wrong. So this can lead to error. And in case of manual activities, the workflow is normally very vulnerable. And if you have an not automatic process, it can be very time consuming if you will do everything manual, if you have to ask and if you have to compare pictures. And if you have an system or if you have a perfect workflow, the patient can concentrate on the core task as a treatment machine. They can spend more time with the patients and they are more relieved. So patients can handle some tasks on their own. They don't need to wait. And if you will use such a system, it leads to a better feeling in the patient and they can be an active part of the treatment. Okay, then I will go the workflow from the beginning to from the check-in at the first part of the clinic to the end to the treatment of the patients. And the first step in my presentation now is the check-in. And what normally happens or what could happen if the patient comes to the practice, and these are all things I've speak with some colleagues. These are things are happen in normal clinics, and a receptionist has to register the patients manually in the oncology information system. This can lead to misunderstandings if a patient is coming and is saying, "Okay, I'm here," and he will say the name, you can misunderstand it, and then you will check in the wrong patient. The employee at the registration desk has to interrupt the normal work for the check-in procedure, and also the private data is not guaranteed if you have to call or if you have to say the names or the birth date. Um, you can use barcode cards, but here, as I told you, you can lost cards, you can forget them or you can mix it up. For the patient call, so after the patient is in the hospital and is checked in, then the patient is sitting in the waiting room. And if you have to call the patient, you can use a microphone and a loudspeaker. And as every one of you know, if you will be in a train or in the train station and there is an announcement via loudspeaker, you can't understand only half of them. So this can lead to misunderstandings. The misunderstandings lead to inquiries to other employees. Then I have to ask, did they mean me and what I have to do? And also, in this point, the private data protection is absolutely not guaranteed. You will call the patients with name or with the birth date, and this is something we will not to do anymore. Or what's for me, it's the worst method is that the staff has to go to the waiting room, will call the patient directly, and will go back to the dressing room with the patient. And this is real waste of working time. Employees are more urgently needed elsewhere for do other work, and I think it can also lead to the dissatisfaction of the patient if the employee has to work back and forwards the whole day. Okay, a technical solution has to come, and what for requirements we are need. So what is important for such a system? We need a system which can be fully integrated in a clinic or hospital workflow. We need a system where in the normal cases, no manual intervention is required. So it has to be completely or nearly completely automated. It should increase the patient safety so that we will know not getting into errors or into problems if we can mix up patients or something like that. It has to save working time and so that the staff had more time for the real important work. You want to have data protection or data privacy protection for the patients. And we need a system what is highly secure and very precise. So if you will have data from the patient stored in the system, we have to be sure that everything is saved and that no one has access to that. And one of the most important things for us was the ease of use for the staff and for the patients. Yeah, and such a system has to be fast and reliable. So it should not stop or interrupt the workflow. It should help and make the workflow more and more better. Yeah, and this is a last point. The system must be easy to install, especially if you want to do a retrofit, then it's easy. It's better if you have a system where you have to do an easy wiring and where you can mount everything everywhere. That it's a really good thing. Yeah, and in general, such a system should make work and life easier and faster. Okay, what is important if you will have an system and you will attach it to some system, it has to be vendor open, and the Synergy system from Carbon is completely vendor open. You can attach it to every system, and you only need a desired or a usable interface. But if you will do the integration in ARIA, you will get more profits. The Variant Fire interface allows several reading and writing opportunities in ARIA. And through this partnership from Varian and ARIA, Varian and Carblon gets this ecosystem silver tier partnership with Varian, and therefore they can use the Fire interface. They use the ARIA API and can improve the integration in ARIA more and more, so that almost everything is possible between Carblon and Varian, and the systems work really well together. Okay, then we will have a look at the system, at the complete system from Kabler Medical we will use in our hospital. So we will use the to-do software as the main workspace for the treatment and the registration desk. We will use the to-do software for the patient registration, and sorry, we will use the patient check-in with this kiosk here for the normal patient check-in for every day, for every treatment. And we are using the patient call-in for the waiting room and the patient verification in the treatment room. Okay, the main window, the to-do software, is for every interaction with the Synergy Go software and the system. And it's used at the registration desk and the treatment room, as I told you. So here you can see the main window, the to-do window, and you can got several information from this window. You can see the patient ID, the patient name, the appointment date, the type of the appointment. So if they will have a treatment, or if you will use it for several machines or several other things, you can see if there is an imaging, or if they have a consultation appointment for the doctor. Here you can see where the patient has to go, for the Halcyon, for the TrueBeam, or for the TrueBeam 1, 2, 3. It depends on you what you have. And here you can see the symbols or the icons, where you can see the status of the patient. If the patient is waiting, if the patient is in the checked in, or if the patient is treated. And if you will use the software at the registration desk, here in front of these lines, you have a small guy with a plus. And if you press on it, the registration desk, the registration window will open automatically, and you will have every information from the area, or you stored an area, every demographics in your system. It's a registration. So if the patient will be at your hospital or clinic at the first time, you have to do a registration of the vein pattern of the hand. And the system uses the biometrical data of the palm veins for the identification. And here you can see graphics how it works. The patient has to lie down the hand on the palm vein scanner. Then you will make a picture of the palm veins. You will extract the important informations, and afterwards you will get a pattern of the palm veins, which is stored in the system. You will do 3 scans for each hand. The first scan, then you will get information. With the second scan, you will compare the first and the second scan, and will create, I will say, a mean value. And if you will do the third scan, then you will make a verification if the scan you will store is correct with the third scan. And then if everything is fine, you will store it. And if you will press this plus button I showed you before, then this window will appear where you can read the name and the birth date of the patient. And if you have all right an image, then you also can see the image of the patient. Yeah, and the ID comes automatic from the oncology information system to the to-do software, also the name and the picture and everything. And here you can see the patient ID is filled in, and everything is all right in the system. You don't have to do it manually. Oh, sorry. Yeah, and it's also a really important thing. The Veeam templates are encrypted, stored in combination with the patient ID, and that this information are stored at the central server from Carbon, and it's located in the clinic, and no one else can access the server. So these biometrical data are really saved, or really safe stored in your hospital. Okay, here you can, or here I will show you a short video from the registration. One moment. Ah, okay, now it works. So the patient is coming to the registration desk. Then the patient has to lie down, the hand on the scanner. The system will ask you, okay, you will have to scan the left hand. Then the patient is putting the hand on the scanner. The first scan will be done. Then you have to put the hand back. Then you have to put the hand back on the scanner. after the second scan, you also have to remove the hand, and then you have to put the hand back on the scanner. And if everything is fine, and the third scan is compared with the first two scans, then everything is fine, and then you can scan the right hand. And as an example for the ease of use, here you can see another video, and here you can see how the system will guide you through the system. So if you have some problems, the system will tell you what's wrong. So here you can see, I will make a short break. Here you can see that the hand is not straight. So the patient has to lie down, the hand straight on the scanner, the wrist has to be here, and then it should work really good. And if you have this hand too high, and the system will see it and will give you an advice that you have to lower your hand. And if you will do that, then the scan will be done and everything is fine. And also, if you will do the scan, if you push the hand too fast or too low in the scanner, then you will get an visual advice that you have to higher your hand. And if you will do what the system is saying, then everything is fine. And here you can see the hand is straight, then the scan will be done. And for the third scan, the hand is lying completely directly right on the scanner, and you can see that the scan is with 100% perfect, and the hand is registered. And this you have to do for the left and for the right hand. And if this is finished, the patient is in the system stored, and everything is fine, and you can use this palm vein pattern for the check-in and for the verification at the treatment room. Yeah. After a successful registration, in our case, we decided that the patient has to go to the kiosk and does the first check-in. So with this method, we will make sure that the registration is being well and everything is saved successfully in the system. And another reason is that the patient will check in for an appointment. And this is the doctor's consultation appointment. And as I told before, the patient registration took place at the first visit, and this is the first part the patient has to do. And if the registration is finished, the patient checks in at the kiosk, then the physician knows, okay, the patient is there, and I can call the patient to the doctor's room for a consultation. And so you can improve your workflow that you don't have to call the doctor, or the doctor has to have a look if the patient is there after a complete succeeded registration. And if the patient has filled out every form and everything, the patient is going to the kiosk, will check in, and the doctor knows everything is fine. And also every day before the treatment, if the patient is entering the hospital or the clinic, the patient has to check in at this kiosk, and then the staff at the treatment machine or the doctor or everyone who wants to know that the patient is there knows that the patient has entered the hospital or the clinic. Okay, patient check-in. If the patient enters the room, the clinic, then he has to go to the kiosk. At the kiosk, you will see a screen, and the patient is also at this screen guided through this complete process. So here is written down that the patient has to lay down the hand on the scanner to register for this appointment. After the check-in is completed or is succeeded, a green check mark will appear, and the patient knows, okay, now I'm checked in the system. And here you can see a screen where your name is written down, your appointment time, and your location where you have to go, or for which appointment you are checked in, and also the initials, which you are called in afterwards if you are sitting in the waiting room. In our case, we decided that we will use the first letter from the name and the first three letter of the surname for calling the patients. And if this is not working, or if you have some patients with the same name, it's also possible to create complete acronym or complete initials on your own, which are not dedicated to the name. Or if you have a patient who will not that a name or the initials are shown, then you can do what you want with these initials. Okay, the check-in is very fast. The check-in result is under 1 second. So if the patient is lying down, the hand on the scanner, immediately the check mark will appear. And this is very important. As we started with such a system, I never thought that this was an important thing. And if the check-in should take 2 or 3 or 4 seconds, I thought it was no problem. But it's a really big problem. If the check-in took too long, the patients have no patience and will go to the registration desk and they are telling, okay, your system is broken and nothing is working, and they don't want to wait. So these first steps, this check-in has to be really fast, and due to this fast check-in results, the acceptance among patients is really high. Okay, this is the check-in monitor you saw it, and you can show appointment informations, and on this screen you can show patient-specific information and you can show general information. So, sorry, general information you can see here. This is an information which every patient will see. Then you can write down notes in the system which will only shown for this patient. For example, if you have a prostate cancer patient, then you can write down, please go to the toilet before you will come to the treatment as a reminder. Then they can read it and they can do it. Or you also can write down an appointment for a dedicated time for the 10th fraction that they have to go to the doctor or something like that. This is something you can show at this check-in screen. Yeah, the call initials are shown, and it's also possible to show multiple appointments as these kiosks. So in our 18 site, we are testing, or we are using now this system with multiple appointments and also with multiple sites. I will come to that later. And the attendance will be shown in the oncology information system. A really good advantage what Carblon developed in the last software version is that you can check into multiple appointments. So after the initial check-in, and if you have additional appointments for this patient, you can check in these appointments automatically. So if the patient has an appointment for the treatment, and afterwards for a doctor consultation, and afterwards for a CT, then you can decide what you want to do with this appointments. And the implementation is completely flexible and according to the customer requirements. So you can do the initial check-in, and then you are checked in for the treatment. And if you want to, the system is able to see if the treatment is finished, and you can also create a delay after the treatment is finished. Then the consultation appointment for the doctor is checked in. The doctor knows, okay, the treatment is finished, the patient can come to me for a consultation. And if the patient has, for example, a CT appointment at the end of this day, then the CT team knows, okay, the consultation is finished. We can call the patient for the CT. Or, and this is what we will do, you can check in every appointment at one time. So you will do an initial check-in. If the patient comes to the hospital, you will scan the hand and check in. And then the treatment team, the doctors, and also the CT team knows that the patient is there. And who comes first gets the patient. If the treatment space is there, then the treatment can call in the patient. And if the doctor has time before the treatment starts, then the doctor can also call the patient. But this is up to the customer, what the customer want to have. Yeah, as I told you, the presence is shown in the oncology information system. Here you can see the treatment console from the ARIA system, and here you can see this check mark and the time of check-in on the treatment console, and you also can see it at the time planner. Here you can see the symbol that the patient is checked in the hospital. Okay, then I will speak some minutes about the call-in system and why is such a system advantages. So if you have an call-in system which is not built from a loudspeaker and a microphone, it can avoid misunderstandings. patients can read it twice, in our case with this monitor, and the data protection is ensured. So we will not call with the real name, with birth date, we will call with his initials, or we will call with the acronym. And here you can see our waiting room in our 18 site. If the patient is coming to the practice and waiting for an appointment, they are sitting here and are waiting for the appointment. And if for example, the treatment will call the patient, then you can see this monitor, and if the patient is called, at the right big side, here is written down, please take a seat and wait till you are called. Then there will appear the initials, please go to dressing room 1, and the patient can see it, can read it, and if this call will happen, also a sound will play it, that the patient's attention will go to the monitor. And it's what I've written down here, the patient can read it twice. After a few seconds, this big screen will disappear, and the call-in will move to the left side, and here you can see, or here the patient can read it. For example, if the patient was for a short time on a toilet or something else and will come back, then the patient can see, oh, I was called, and then the patient can go to dressing room, which she is called. And also, if there are some other calls, if you will use it for multiple locations, or if you have more treatment machines, then the patient can see where they are called. And a really cool system or a thing in the new version is that you can use the system as an information system for the patients. Here you can see the call-in monitor, and at this big window or this big area on the monitor, you can show a video for merchandising or for information for the patient. And here you can see an information part of our hospital. Yeah, the call-in system also can handle more than one location. As I told before, in 18 we have it installed for the treatment machine and also for 4 doctor rooms. And the doctor also has the to-do software, and the doctor can see that the patient is checked in, and the doctor can call the patient from the room that the patient can go or should go to the room. Then the patient will see at the caller monitor the initials, and please go to consultation room 1, 2, 3, 4, however you will call it. And what we also will do in the future, we will implement it in our radiology department. And here we have 3 different waiting rooms for the MRI, the CT, and the treatment machine. We have 6 control rooms from where we will call the patients. We have 7 consultations rooms where the doctor will speak with the patients, and we have 10 dressing rooms. And in the future, we will implement the system to the radiology department, that we will improve our workflow more and more, that the patient that no one has to go to a dressing room, or that no one has to go to a waiting room, sorry, and have to call the patient, that everything will be more and more automated. Okay, the call-in system will be used from the treatment room in our cases with the to-do software. And if the patient, if the staff will press on this button, normally if there is a patient called in, then you can see here the time, the waiting time the patient is in the clinic. Then you can press on this button, and the patient will be called to this dedicated dressing room you can choose here. But you don't have to choose the dressing room. The system will choose the dressing room automatically. If you now have called or have opened the dressing room 1, afterwards the system will automatically choose the dressing room 2, then dressing room 3, and afterwards dressing room 1. If you have a problem in dressing room 2, or if there is someone who will speak with the patient in this dressing room, then you can block the dressing room, that you can't call the patient to this dressing room, and you also only can use the other dressing rooms. And yeah, this is a really, really necessary, really good solution, because in our case, we have it often that the doctors will speak with the patient only a few minutes in the dressing room and not in the doctor rooms, and so you can block the dressing room. Yeah, you can see at this monitor, this main window, the overview, which patient is waiting, which patient is being treated, and which patient is called, and you can call the patient. Okay, and in almost every patient, almost every control room, you will have something like this. We have multiple monitors, everything is full with technique and with equipment. And if you will use this small monitor or this small lines and symbols for calling the patient, then it's not really comfortable. So you have to go near to the monitor to read it. Then you have to make sure that you will press the right button for calling the patient. And therefore, Clablon has developed in the last version the so-called daylist mode. This daylist mode is used in the control room, and you also can use it in other rooms, but we will use it now in the control room. And here you have an bigger view with bigger columns where you can call. Here you have a big button. This under this marked column is also this column what you can see here, and you can press once on this button, then you will call the patient. Here you also can choose a room if you want to choose a dedicated room. And for safety reasons, you also have the patient picture, the name, the surname, and the birth date for the patient. This daylist mode has also two different modes. You can use it with the next appointment in list mode or with this longest waiting patient mode. So if you will have a normal day, then you will choose every appointment after each other, and then you don't have to choose some of these columns. These button will be underlined for every time with the next patient who has an appointment. Or you will use the longest waiting patient for example, if you have a machine broken and you have 20 patients waiting, and then you can choose the longest waiting time will be the first who are treated, and then the system will automatically call the next longest waiting patient. But if you will make, or if you will have a patient who you will call at first, then you also can press the column and you can choose this patient. You don't have to use this automatic version. Yeah, and after you have called the patient verification has to be done, and the patient verification by Synergy Go is provided as a medical device class 1 under the CE and MDR regulations. And the LINAC is blocked after a patient is called at the treatment with an interlock, and you can't treat the patient without an verification. Here you can see how it looks at our sites. Here you have this verification terminal. Here you can see the informations. Here's a palm reader, and the patient can, in our case, the patient can, after entering the room, can scan the hand and can do the registration. You also can decide to mount this device everywhere where you want it, and you can decide to use it even if the patient is lying on the table. Then you can put the scanner out of this mounting, and you can took it to the table. This cable has a length of 6 meters that you can go everywhere you want to. Or even if you have a patient with a wheelchair or in a bed who can't reach this reader really good, you can put it out and can bring it to the patient. Okay, this is the image or the screen the patient will see if the patient enters the room. And also in this screen, the patient will be guided through the system. So here is written down, please lay your hand on the scanner. The patient itself can compare the picture and the name and the birth date if everything is right. Put the hand on the scanner and the verification will be done. And after the match is positive, the treatment interlock is released and you can start the treatment. But what's happened if you have a problem, the patient is not registered in the system, or the system can't read this hand, you can override the system in the system. You can override the treatment interlock in the system. Then you have to press this button, and the system is overwritten by a dedicated staff member. And the override is also logged in the system with the name of the staff, with the date and the time, so that you can make sure if there is some failure or something goes wrong, that you can have a look what happened there. The connection between the verification terminal and the LINAC is done via fiber connection, so that you don't have any problems with EM signals or something like that. Cablon will connect the I/O box to the treatment or to the treatment unit, where you have a normally open or a normally closed contact available. And for safety reasons, the normally open contact is really important. So if the software crashes or freezes, the interlock remains. And also if you will close the software or at the morning you will not open the software, the interlock still remains. So you can't treat without the system. But if you will have a problem with the system, what normally not happened, you have a key switch or a normal switch for override the system, and then the interlock is released in case of a failure, that you can do your work also without the system. We are working together with Carblon for several years, and we are a development partner for Carblon, and therefore Carblon decided to produce a video in one of our sites in 18, and I will show you this video. And this is a really cool video with showing you the complete workflow from the beginning to the end.
Providing the right treatment to the right patient is essential in healthcare and begins with a streamlined, integrated workflow. From the moment a patient enters the hospital up to the treatment room, every stage of the process is designed to support both patient and healthcare professionals, ensuring precision, efficiency, and safety throughout the care journey. During the first appointment, both hands are scanned. Patient identification by SynergyGo makes it possible to uniquely distinguish patients based on the palm veins. The infrared scan is converted into a double encrypted biometric template, which is separately connected to the patient. After patient identity registration, accessory registration will take place during the CT process. Designated accessories are selected for the right treatment to ensure the patient posture remains the same throughout each treatment. Specific patient notes and/or accessories can be added. SynergyGo has three main advantages: high accuracy, fully integrated into the OIS workflow. Interlock prevents incorrect treatments. Once registered, only one hand needs to be scanned at the check-in kiosk to confirm the patient's attendance. The patient is guided to the correct location with patient-specific information. A staff member calls the patient from the control room without going to the waiting area. An anonymous patient call-in number shows the next step on the TV screen. A staff member selects the patient treatment plan in the oncology information system. SynergyGo will open automatically. The accessory verification system streamlines the patient setup process by indicating which accessories are required. The accessories are scanned to confirm their presence. When entering the treatment room, the patient's hand is verified. The treatment room is blocked by default. Without a valid verification, the treatment will not start. If needed, a staff member can override the system. Streamlining the whole treatment process enhances precision, efficiency, and safety for both patients and staff. SynergyGo, extremely precise, user-friendly, high level of security.
Yeah, this was a short overview over the complete system and the complete workflow, and a little spoiler of my next part of the presentation of the accessory check. And this is completely new. We are using the first version in our clinic, and it's a software-supported immobilization device documentation system. So I will call it. You can see here the main window from the system, and you will do the first registration of all devices normally in the CT room. You can register every global device, and you can also register patient-specific devices like patient masks or bolos or yeah, everything what you can mention, what you want to register. And you also can enter the setup notes from the CT directly in the SynergyGo accessory check software, and then you can see it in the treatment room, and you don't have to copy and paste it in the OIS system or how you will do it nowadays. You can verify all the devices in the treatment room at the first time. Then you can make sure that everything or the setup is completely the same like you did it in the CT. You will do the verification with a barcode scanner. You have to scan, you've seen it in the video, you have to scan the devices, and you will get a sound, a beep if everything is fine, and a bad sound if the scanner scanned the wrong device. you can see in this window if you scan every device you need for this group. So if you will have an headrest, for example, you need a pillow and a wedge, then you have to register, or you have to verify that these 3 devices are there. And if you will register a wrong device, then you have to do the registration of these groups anew. And also, if you need a knee board or something like that, you can register it, and then you have to verify it at the treatment room. And until everything is correct, there is an interlock, like with a verification system, and you can't treat. You can use a separate monitor, or you can use this existing one. It's up to you. If you will use an existing one, Carplon will attach a monitor switch box between the existing monitor and the new system, which will switch the monitor automatically from the one to the other system. Yeah, the treatment table is, as I showed you in the picture, divided in 3 groups. You can attach the devices related to the group. Then you can scan the devices with a barcode scanner. Here you can see the barcode at this knee board, and it's not a barcode, it's a QR code, but every QR code is unique, and you have to put it on this device, and then you can scan it, and the system knows that the right device is on the table. Here we can see a short video how it's working, and you can do the accessory registration. The patient is opened automatically from the DYN'R work list or from the treatment console. You can register the devices by scanning this barcode, and if you want to register a patient-specific device like this, here's it's a head mask, for example, you can register it. Then you will print a barcode, put it on this device, and then you can make sure that the right patient mask is present at the treatment room or at the treatment for every fraction. Okay, here you can see the work or the workflow with a monitor we already have in the treatment room. We decided to use a big identify monitor from Varian for the use of the accessory verification system. And if you will open the patient at the treatment console, the monitor will switch to the verification software. If you register, if you make a verification for every device, the system will switch back to the identify monitor that you can do your normal treatment. And here you can see if you will scan a wrong device, you can see it here in red. Then you have to rescan the devices, and if everything is green, you can treat. And after a few seconds, the monitor will switch back to the identify monitor. And also, if you have a patient without any accessories registered, you can the monitor will switch to this accessory verification software, and if the software mentioned, okay, there is no accessory registered, then after 5 seconds the monitor will switch back to identify, so that you don't have any problems with your normal workflow. Okay, and yet now what's completely new with this system? We are using the prototype system from Carplon because the development is still processing or still in progress. Every day or every week we got something new from Carplon, and now we have I will call it semi-automated immobilization device recognition system. And the goal is in the future that we will get a fully automated system where you can put every device on the table at the CT. You have to press one button, and the system knows what's located or what is on this treatment table. And also for the verification, you will put every system on your table, every device on your table, and your system knows, okay, it's wrong or it's right, and you don't have to scan anything, and it's completely automated. But here the work is in progress, and as I told you, we are using a prototype. It's an RFID-based system, and it's for auto registration, auto detection. Here you can see a RFID antenna attached to the ceiling. On these devices, on the immobilization devices, we have to put on an RFID tag. This RFID tag is unique, and if the antennas read this RFID tag, then the system will release the interlock. These antennas are so mounted, or so the settings are so that you only will see the area of the table and a little bit beneath the table, but not the carpets or the other parts of the room. So that you can put everything on the table and automatically, without any manual interaction, the system knows, okay, everything is fine, and you can treat. This is a really improvement of time for this safety reason. Okay, at the end of my presentation, I will give you some advices what you have to do if a problem occurs. I also can tell you that you don't need to call often the support because the system works really reliable. But if you have some problems, you will have some icons on your screen of your workstation, and you can send a request for help at any workstation or from any workstation where Synergy Go is installed. You can start the help desk. Then you have to put in some information, what's the problem, and if everything is finished, you can also stop the help desk connection. You can start a call if it's really important or if it's really emergent, and you can send a mail if you have a question or if you have something what's not really urgent. And if there is any problem, you can connect to the support, and you will getting competently help at really short terms. Okay, I will come to my conclusion. We have a complete or an entire system for patient guidance and verification with the Synergy Go system from Carblon. The system is completely vendor open. You can attach it to every system you want to. But due to the interface to Varian, you have a really good integration in area, and you can do almost everything you want to. It increases the safety really much because you are really sure that you will treat the right patient. It increases the workflow with this call-on system, with everything. It's for us, it's a really helpful system. It saves working time and it makes life easier for the patient. They don't have to hear it twice. They can read it. They don't have to call the registration staff. They can only put the hand on the scanner. They don't have to wait, and everything is fine. And it increases the the private data protection from the patient. And a really important point is that the system is highly secure. The data is saved, encrypted in a server. It's located in your hospital. It's extremely precise with the palm beam scan, and it's of course very user-friendly that everyone can use it. We have now more than 4 years experience at all sites, and we have almost 10,000 patients registered during this period. And the system works on almost every patient. The registration has to be done exactly as specified. So if you will train your staff correctly, then the system will work without any problems. The staff must be well trained. Otherwise, the system could not work. And this bottleneck of the system is the registration. And if the registration is done correctly and everything is fine, then the complete system is working without problems, without failure, and everything is really good. This is the point of my perspective in our clinic. The system works really reliable, so we are treating about 80 patients per day per treatment unit, and we have less than 5 overrides per week. So I think this is a really good thing, and these overrides are normally because patient is coming to the treatment and there is no registration done before. I can't say you why, but sometimes that the patient is not registered. This is a problem with our staff, not with the system. And then we do an override and everything is fine and we can use it. Or if the patient has only registered one hand and the patient has scratches on the hand, then you can't register or you can't do the verification with the hand, then we will override the hand, the patient, that we can do the treatment. But also, if you will do the override at the treatment console, you have the picture, the name, and the birth date, and then you can compare it manually like you did it before. Okay, and the conclusion for the accessory check, we have a manual accessory verification method. This can be registered for every accessory. You can register patient-specific accessories, and the system increases safety rapidly. It works really reliable, and the workflow optimization between CT and treatment is really good because you can get the information from the CT directly to the treatment room. You don't have to do copy and paste. You can store pictures of the patient setup and everything you can see at the treatment room. It's a really workflow optimization for us. But we are using the prototype now, and now we have an automated system and we have an automatic accessory detection and verification. So this is a really cool point and a really cool development we will use now. We have also every accessory who can be registered, and also the patient specific accessories can be registered with this automated RFID system. Now with this RFID system, you don't have to put on the QR code on your patient mask. You have to put on a RFID tag. That's it. And we have a further increase of safety due to the automatic device registration. So we don't need any manual registration at all. It works also really reliable with the RFID system, and yeah, the workflow optimization is the same like the first system. Okay, then I will be at the end of my presentation. I will thank you for your attention, and if you have any questions, feel free to ask. And if you have questions in the future, you can write me an email, or you can connect to me at LinkedIn, or you can see me at the Astro 2025 at the booth 232 from Carbon. Thank you.
Thank you, Markus. That was a great presentation. We actually already have some questions in the chat. Okay, so the first question would be, how is the kiosk good from a hygiene point of view?
Yeah, that's a question I really often hear. And every time I can say how you will handle the hygienic problems with your doors. Everyone is coming to the clinic and to the hospital will pressing on the door and will put the hands on the door and everything. We are advising our staff to clean the palm bean scanner at the kiosk every half hour or as they need it. And for us, it's a really it's a good thing. It works.
We actually have another question about hygiene. Why the system does not use facial recognition to reduce hygiene issues?
Sorry, I can't understand you.
So the person is basically asking why we use the hand palm versus the face recognition.
Okay. Yeah, you can buy a system with face recognition, but I think this is sometimes an psychological problem. If you have a patient with a head and neck cancer, for example, and you will make a picture of the patient from the first time, and if you will see the patient 2 weeks later, then it looks really bad, I will say. So it's not really good. And we decided to use the system with palm beans because we don't want to have it. That's fine for me. If you will have more information, you have to ask Kaplan, please.
Yes, I believe Kablan has more information on that. And the hand palm recognition was the most precise system, mainly because in people that have these type of pathologies, there is sometimes a modification of the face due to the treatments. So the hand palm will not change, but the face may change. But if you want to have more information, you can shoot me an email. I'm gonna write down my email contact here, and we will send you more information. We have another question here. Does patient check-in on Synergy Go cause automatic selection of patient record in ARIA?
What do you mean with the patient record in ARIA?
Okay, I will see if the person sends
Yeah.
us more detail. We can come back to this question.
Yeah.
We have another question about languages. How would you confirm the communication with difference in languages in the
Yeah.
waiting hall?
In the waiting hall. Okay, in the waiting hall, I can't say it to you because we don't have the problems. We use the German. At the kiosk, you can switch to different languages you can implement in the system you want to have. But our kiosk is only working with one language at the moment?
That's a great question that we can ask the manufacturer to see
Yeah.
if there's a way to modify the language on the call-in system. Absolutely. We still have some time for more questions. There's still a lot of people connected. Everyone from the presentation is still here, so feel free to send your questions in the chat or use the Q&A. Okay, so the question that we had earlier, the person sent us more information. Okay, so the question was, does patient check-in on Synergy Go cause automatic selection of patient record in ARIA? And then it was added in ARIA, select the OIS file/record for the patient containing things like MLC shape, MUs, energy, etc.
Okay, the Carbon system will not open or write anything in the ARIA system. You can see the attendance of the patient in ARIA, but the call-in, the check-in or the verification will not open anything. You have to open the patient as you do it now in the treatment at the treatment console, and you only will have an interlock for the treatment till the verification is done. The Carbon system is not opening or is not doing anything at the ARIA system.
Okay. And so, like Markus mentioned, he will be on the booth of Kablon during Astro. So if anyone is going to Astro, feel free to go visit the manufacturer, and DYN'R will also be attending, and the booth number will be 2233. Okay, one more question here. What's your view on the barcode verification rather than kiosk?
With difference between the barcodes and the kiosk?
Yes. What is your opinion on the barcode verification versus
As
the
I told
kiosk?
at the beginning of my presentation, the barcode cards can lost, the barcode cards can mixed up, the barcode cards can be forgotten at home, and we have seen several hygienic problems with the barcode cards due to patients who was sticking the cards in the mouth for disinfect their hands or something like that. Because of that, we don't want to have these barcode cards anymore.
Okay, very good. And then so we have someone from the manufacturer side that can answer the selection question. So, Yurian, you can unmute yourself if you want to reply or write your answer in the chat, and I will read it for the audience.
Yeah, I think you can hear me. Is that correct?
Yes, we can. Thank
Yes,
you,
okay.
Jürgen.
Maybe I can answer the question on the selection question. When we developed the system, the main idea was not to influence the workflow. So we don't influence the workflow as it is. So normally you select your patient as normal, and Synergy Go is a real verification solution. So we verify your selection. So selecting the patient means you're expecting that patient, and we also verify that that patient is actually in the room. So it's a real safety issue. It's not a selection mechanism that we provide. It's really based on safety and on verification of your selection against the real patient in the room. I hope that answers the question.
Got it. I'm sure it does. Yes, okay, it does. So the person just wrote it makes perfect sense.
Yeah, okay, very good.
Yeah, so everyone, we have a great opportunity here. We have a lot of people from the manufacturing company that are connected. If you have any specific question, even technical, they are here to answer you. And if you are based in the US, you can contact us at the email address I will write down in the chat. And if you are based outside of the US, we can direct you to the manufacturer. So send us an email and we'll make sure to take good care of you. We just wait a few more minutes to see if any other question comes up. Otherwise, I'd like to thank you all for being here today. All right. I think it will be it for today. Thank you, everyone who attended. And the recording of this presentation will be available on our YouTube channel probably by tomorrow. Thank you, Markus.
You're welcome.
Bye, everyone.
Bye.
Okay, bye-bye.